my name is Yammine, and for my clinical specialty HOSA video, I will be doing heart auscultations. Hello, I'm Anna.
Hey, I'm Brandon.
Nice to meet you, Mr. Brandon.
Nice to meet you, Miss Yammine.
Today I will be doing heart auscultations for you, okay?
Oh, okay.
So the first thing I need to do is sanitize my hands and put some gloves on. Now that our gloves are on and our hands are clean, it's time to put on our stethoscope. When you're putting on your stethoscope, there are some key things you need to know. First, there are these earpieces. The earpieces need to be faced at an angle towards the front of your head, as if they're pointing in towards your eyes. In addition, you need to understand the head of the stethoscope. There are two parts. The larger one, which is known as the diaphragm, and the smaller part, which is known as the bell. You switch between the two by turning. You'll hear a little click, and you'll know which setting it's on. To be sure you're on the right setting, you can put on your stethoscope and lightly tap on the head. Whichever one is louder is the setting that you're on. Now it is time to begin the heart auscultations. You need to make sure your patient isn't wearing any excessive clothing. So Brandon, please remove your jacket.
Oh, of course.
Now Brandon is wearing a shirt here to preserve his privacy. So basically here I have drawn his midline, and here will represent his nipple line. First we will begin with the aortic area, starting at the right second interspace. This is called the right interspace because it's Brandon's side, so this would be the right side of the patient. In addition, it is the second interspace because it is the second intercostal space, or the second space between his ribs. Next, we will move into the pulmonic area, starting with the left second interspace and then moving down into the left third interspace. Next, we'll move into the tricuspid area. We will go into the left fourth and the left fifth interspaces. Finally, we will go into the mitral area, listening to the apex of the heart, which is the very base of the patient's heart. Now we will switch from the diaphragm to the bell side. Tap to be sure you're on the right side. We will now listen to the fourth, fifth interspaces, and finally the apex once again. Remaining on the bell side, we will now listen to the patient's carotid arteries. If you were to take your fingers and palpate the sides of the patient's necks, you would be able to feel the carotid arteries. Be sure not to apply pressure to both arteries at once, as you would cut off blood flow to the brain. When you are going to listen to the carotid arteries, you will ask your patient to tilt his or her head upwards. Using gentle pressure with your bell, you will listen to each side of the carotid arteries. When you're doing so, the patient needs to be holding his or her breath. Now that we are done with our procedure, it's time to explain any findings to our patients. Brandon, I did not notice any heart murmurs while listening to your heart, nor did I notice any bruits in your carotids. Your heart rate was between 60 and 90 beats per minute. You're a very healthy patient.
Thank you, Miss Yammine.
Thank you, Brandon.